Hi all, my name's Jocelyn. Nice to meet you virtually. My name is Jocelyn Leeming and I'm a registered nurse working in clinical informatics at Malaffi. My background is cancer care nursing in Australia, the UK and the US, as well as clinical informatics.
Hi, nice to meet you all. My name's Louise Jackson. I'm also a registered nurse working at Malaffi, and my background is in mental health nursing in Australia and the Middle East, as well as clinical informatics. Jocelyn and I are both part of the clinical adoption and informatics team at the Abu Dhabi Health Information Exchange, which is also known as Malaffi.
So today, virtually, we want to introduce you to the Malaffi Patient Health Information Exchange platform that's been rolled out across the Emirate of Abu Dhabi. Now, Malaffi is currently being used by over 20,000 nurses in the Emirate of Abu Dhabi, which is fantastic. Throughout our presentation, as two nurses living and working in the Middle East, we will discuss how we have been heavily involved as the clinical subject matter experts during the development and implementation of Malaffi. We will also demonstrate specific use cases where having access to a single patient record has helped our clinical nurses in their practice, while highlighting patient safety benefits of the system and finally discussing how Malaffi has been integral during the COVID-19 pandemic.
To give you all some background, Malaffi is the first health information exchange in the region, in the Middle East. Malaffi has been really an important part of the Abu Dhabi Department of Health's vision and strategic initiatives for transforming healthcare in the Emirate. In summary, for the last 2 years, we've been really busy connecting the electronic medical records, or EMRs, of all healthcare providers, public and private, across Abu Dhabi. And in doing so, we've been able to provide the clinicians a consolidated view of their patients' real-time information from across all the different healthcare facilities in the Emirate. And with this wealth of clinical data, we've been able to provide insights as well, using our analytics platform to support the population and public health initiatives of the Department of Health, such as the response to COVID.
So why did Malaffi eventuate? Now, as you know, many healthcare systems across the world suffer from fragmented care, and this is due to the healthcare silo. Multiple medical record systems, time-consuming duplicate entry of data, and poorly configured systems without the patient or clinician in mind has contributed to substandard patient care, compromising patient safety and data quality that is often worse than when we were using paper-based systems. As clinicians, we really need to embrace the digital transformation within healthcare to provide quality patient care and deliver the best patient outcomes, which is what we as clinicians want. With the patient as our focus, communication and collaboration between healthcare providers through sharing of real-time patient information is key in achieving integrated care management that supports coordination of care, reduces inefficiencies, and improves population health data. Now, with this in mind, the Abu Dhabi government, the Department of Health, has taken digital transformation very seriously and has implemented the Malaffi Health Information Exchange platform. The aim of Malaffi, as I said earlier, was to break down those silos across the healthcare system and centralise the patient health data in hope to improve the quality of care delivered in the region, despite the numerous EMRs and health information systems across the Emirate.
So to summarise where we are to date, we now have 100% of the hospitals connected with only about 600 clinics and pharmacies still to connect. So that's 1,430 facilities, hospitals, clinics, medical centres that are sending us real-time data from 57 different EMRs. This covers around 97% of patient care episodes in Abu Dhabi, and we are continuing with this effort of connecting with the remaining every day. So to translate this into practical terms, as a nurse in Abu Dhabi, you should be able to see most of your patients' visits, so their encounter and the doctor that they saw and any other clinical information from that visit, to any of the hospitals and clinics in Malaffi, and it's directly accessed from their EMR. I'm going to take some time now just to discuss with you in a little more detail about the clinically led implementation and the data available in Malaffi. As nurses and from a team that is nurses and doctors, we've been really lucky that the project was clinically led. And where our clinical team was in place very early at the beginning of the project, at the beginning even with the strategy of the project, alongside the key technical members. So as the subject matter experts, we've had to choose the most relevant data to display to our clinicians that will benefit the care of their patients. As you can imagine, Malaffi accepts and stores a huge amount of data from each of the hospitals and clinics, which will in the future and now be very useful for public health analytics, but not all that data is helpful for clinicians. And we don't want clinicians having to sift through the information to try and find what's useful, because we already have that sometimes in the medical record system. So we have been involved, our team, in selecting what should display, what is the most useful for clinical practice for our doctors and our nurses. We've also been responsible for the format and customization of the provider portal. So again, in terms of the data that's shown, we've been responsible for ensuring that the format and the functionality is user-friendly and makes sense in terms of the clinical workflows. So as a doctor or a nurse using their EMR, how is the best way to show the data through the EMR for that clinician in their workflow with the patient? As clinicians, we've also been involved in the workflow analysis of the different medical record systems that connect to us. So far, we have over 50 plus, as I mentioned, different EMRs that are now sending us data. And they range in levels of being very, very basic to comprehensive medical record systems. So we reviewed each of these EMRs and they're reviewed with a technical and a clinical eye, just to understand how information has been documented. And we also had to make suggestions on improvement, where they need to capture some more information or change the way they record some information. And they had to then configure those systems before they connected to us. So as having the clinical eye, the nurses and the doctors on our team to do that means that we get a more relevant change or relevant configuration clinically. Another area, or the last area, is user acceptance testing that we wanted to mention today. So that's ensured the involvement of clinicians in our current healthcare market, so in Abu Dhabi. For the larger hospitals and clinics and for the new releases of the portal, we carry out user acceptance testing with clinicians at each site. And this means that the nurses and doctors get to see their data being displayed in Malaffi before they go live. And they can even provide us any insights into their workflow that we may have missed initially. And they can act as champions for Malaffi after they go live, which is always helpful because they've seen the data, they've seen how it works, and they're excited to use it in their hospital.
So I guess what data have we been involved in to include in Malaffi? So what will you see as nurses and I guess all clinicians? You've got patient demographics, patient encounters, problems and diagnoses, allergies, vital signs, laboratory and radiology results in report form. Images are coming in the future, as I'll touch on shortly. Medication lists, immunisation lists, procedures and clinical documents, which include your outpatient clinical notes, discharge summaries, referrals and procedure reports at this point in time. And as I said earlier, radiology images. So that's coming very soon, which is really exciting. So a full breadth of patient data available to you directly through your EMR. And obviously, once we've captured that data, how does it display? And this is basically just a snapshot of the patient summary screen, which I'll take you through shortly, obviously just following this in the test system, just so you can actually see what it looks like and how it displays. But basically, we use seamless EMR integration and consolidate that data to display here in this list view. So I guess, as I said, it's probably really important for you to see how that looks in the system and what information and where it's stored. But I think really to get a better idea of how Malaffi can, I guess, improve or add to to the value of your care that you're offering, I think it's really important to show some examples. So there are numerous instances where Malaffi can add value to clinical practice and improve your patient care, but I think it's really important to see some real life examples. So, obviously having access to your patient's consolidated health record in real time can improve help us make more informed decisions and improve those patient outcomes, which is the whole purpose of Malaffi, as we said earlier. So I think really now is a great time to demonstrate how Malaffi is used in practice and how it can improve the quality of care that we deliver as clinicians. So we're going into our test system, and this is not real patient data that I'm demonstrating here. But basically, this is an example of a 34-year-old woman named Mariam, and she's presented to Cleveland Clinic Emergency Department today. Now, she's unconscious after having a fall and having a large laceration to her head. Unfortunately, as she's unconscious, she presented in an ambulance on her own, so no family members with her. And as she's unconscious, she's unable to relay any of her past medical history to me or my clinical team. So without Malaffi and prior to Malaffi, there would be no information available to me, and I'd be almost going in blind treating this patient. She's never been to our facility before, so unfortunately there's no data on her in our EMR. Now, accessing Malaffi, so obviously with Malaffi, I can see this consolidated data of her whole health record from all the facilities that she's actually been to in this region. So at a quick glance, I can see that Mariam is allergic to peanuts. She has an anaphylactic reaction, so we will avoid giving those. I can also see that she's allergic to penicillin, and it's quite a moderate reaction. Now, in this instance, she's had a fall and she's got a large laceration to her head. So and if I was to give an antibiotic, I would know by seeing this data in Malaffi to avoid giving amoxicillin and then thus avoiding any harm to Mariam. I can see her recent admissions as well, and I can see here that she's had some hypertension. So as, again, a clinician looking after her and she's unconscious, I would know that I'd have to monitor her blood pressure throughout the time that she's with us. I can also see that she's got diabetes, and now she's fasting. Obviously, she's unconscious. It would be something that I have to monitor as well, her blood sugars. Now, given also the wind behind us with COVID, it's really important to see if she's had a recent PCR test. So PCR tests are available in Malaffi, and they sit under molecular here. I can click on this and to see if she's had a recent test, but no, nothing recent, but it looks like back in 2020, she actually had COVID and then subsequently recovered. So I would know that she's actually had COVID in the past. I may also want to look at her vaccination status to see if she is vaccinated or immunised against COVID. And I can see here she's had 2 instances of the Sinopharm vaccine back in January 2021. If I also wanted to look at any previous radiology images to see if she's got a head injury, to see if there's any past head examinations such as CT head or whatever, I may want to look in the radiology to see if there's any previous existing tests that I can compare. I also may want to look at her vital signs from recent admissions to see what a standard blood pressure is for her. And also, if I want to look at her blood glucose, I could look in chemistry and find that as well. Also, if I wanted to look at her recent discharge or summaries from any recent admissions or any procedures that she may have recently had. Now, obviously, having this access to the consolidated data can improve how we deliver the care to Mariam and hope that she has a smooth recovery.
Okay, thanks, Jocelyn, for the demo and for showing us that use case where it's really clear that having consolidated records from all the different facilities in Abu Dhabi can really make an impact on the patient care, especially, as you mentioned at the beginning, the patient is unconscious and may not even have family members with them. So definitely an interesting and clear use case for having a health information exchange. You also showed us the COVID vaccinations and the PCR tests in Malaffi. So I just wanted to talk a little bit more about that. Obviously, we were very well placed at the beginning of the COVID pandemic to help with the reporting because we already had so much patient data, and we were linked already with many facilities, so we could accept all the PCR tests and use that for analysis. So we were able to help with streamlining the reporting. To assist with the point of care and operations, our team built the Malaffi team applications built a web-based module that allowed the Department of Health and frontline clinicians to quickly search for COVID-19 related results. So they were able to search by the patient's identifiers, so Emirates ID, outside of their EMR, and even by their phone number, and even do bulk search. So look from a big group of patients. They were able to then see whether they were positive or negative and where they had their tests done. And now, since the beginning of immunisation delivery, DOH and other clinicians and hospitals are able to use this to search for their patients' COVID-19 immunisation information, which has been really helpful for clinicians to have a centralised place to see who's had dose 1, dose 2, and now subsequent booster doses. Our Malaffi provider portal, which Jocelyn demoed earlier, has also, of course, assisted with point of care, because as you saw, clinicians now have the COVID-19 results and COVID-19 immunisation information available immediately to them as soon as they see their patient. And it's accessed from their EMR. So they can see PCRs that have been done, even at another facility or lab, along with other important clinical labs that may have been done at the same time. So both these tools have really assisted staff to correctly triage and care for their patients during the pandemic, as well as assisting hospital operations to even to as simple as allocating staff appropriately, because they have the real-time PCR access, PCR results of their staff and the immunisation status as well. So moving from point of care to more about the reporting and the analysis, we've been able to assist the Department of Health with various extracts of data and dashboards for a higher level view of the numbers and the view of COVID in Abu Dhabi. So for the dashboards using Power BI, we've worked with the department and the infectious diseases departments to define what they need to see operationally. What numbers do they need to see? What do they need to report on? What patient demographic details do they need to follow up with patients? So the current focus on immunisation has meant new dashboards that assist with visibility on vaccine requirements and distribution, demographic statistics for those that are immunised, and also visibility on population percentage vaccinated. So finally, as well as assisting with the right information at the point of care and operations and reporting, with this central collection of data, we've also been able to assist with highlighting data quality issues. So as you can imagine with Malaffi, we can see a lot of information from all the different facilities. We can see who entered it, and we can see some gaps, which is inevitable across any healthcare system, multiple healthcare systems. So specifically with the immunisations and PCR records that we are receiving and any clinical workflow discrepancies, we've made sure that the dashboards also report not just the KPIs, but look at the key areas to focus on in terms of data quality improvement, so that we can work together and quickly get data coming back to us that's corrected or updated, and that we're reporting on the correct numbers and that we're giving the correct patient information, giving the correct information for our patients. Thanks, Joss.
Thanks, Lou. So I guess that really, to finish up here, as you can see over the past 2 years, Malaffi has come a long way connecting the majority of healthcare facilities in the Emirate of Abu Dhabi, with the ultimate goal, as we said earlier, to centralise patient data in one consolidated record accessible to all clinicians in the Emirate. Not only are clinicians happy, as you can see here in some of these testimonials, to have a consolidated record of patient information, but patients themselves feel confident that their critical health information is available to their clinicians that they visit, ensuring their patient safety and improving the quality of care that they receive in the region. Now, as we mentioned at the start of the presentation, information sharing and clear communication amongst caregivers through the Malaffi Health Information Exchange is integral in delivering safe and quality patient care. As a nurse, and I'm sure I'm speaking for Lou on behalf of Lou here as well, we are incredibly proud to have been part of such a significant healthcare initiative. Thank you so much for your time today. Virtually. We really appreciate you dedicating the time to listen to our talk and learn a little bit more about Malaffi and how it can improve the quality of care in the region, but also improve the quality of care that you give as a clinician and make you feel more confident in how we're actually treating our patients and we're treating them, efficiently. So to finish up, I think it's really important, we'd love you to see how Malaffi has helped one of our nurses, one of the many in the region, in her clinical practice as a paediatric nurse.
Malaffi is helping us to provide the best quality care to our patients, because when we get really complex pediatric patients to our department, we have an access to see the previous medical history of the patient, and that decides the care of the patient. And it also helps us to reduce the questions that we ask to the parents, like what medications are they on, or what are the procedures, labs, radiology, which is done earlier, what are the treatment done earlier. So these questions we can reduce to the parents, and we can focus on the care of the patient, and we can focus on the Malaffi, so that we'll get more concise information from Malaffi.